My name is Lindsay Hall, and this is the solution to less medical errors. America is falling victim every day to the injuries and deaths caused by medical professionals. Medical errors are the errors caused by medical professionals that cause harm, injury, or even the death of a patient. With the implementation of two systems in medical facilities of the U.S., the number of such adverse events can be dramatically reduced. The death toll. According to a report published by the United States Institute of Medicine, it is estimated that between 44,000 and 98,000 people are killed each year by way of medical error in the United States alone. And according to Daniel McCary, there are over 251,454 deaths each year. This number would place medical errors as the third leading cause of death in the U.S., just beneath heart disease and cancer. Despite the fluctuation in data, it is evident that this is a major issue in America's healthcare system. There has been no record of large-scale solutions that would resolve the problem, but in localized areas throughout the nation, precautions have been implemented to help minimize the number of deaths by medical error. The American Society of Health System Pharmacists, also known as the ASHP, released a guide that states obtaining medication history and performing medication reconciliation on admission are crucial, and it is recommended that pharmacy be involved in obtaining an accurate medication history. This statement shows the importance of obtaining the appropriate and correct patient history to prevent medication errors. Even though it is mostly pertaining to the pharmaceutical aspect of the hospital, it is a crucial piece and a step that helps improve the statistics. They have put these guidelines in place to help improve patient safety and limit the number of medical errors. Where they have failed is when overworked professionals try to save time by cutting corners. In other areas of the nation, they have implemented technology to reduce medical errors, as stated here. Hospitals have implemented automated dispensing systems and barcode technology to decrease errors. This is a great solution and has been linked to a reduction in medication errors by 54 to 87%. This solution can only improve by expanding this technology to include other hospitals in the United States. The solution. The number of patient deaths due to medical errors can be dramatically reduced if America's healthcare system would implement the solution of a universal electronic system for patient records and a standardized system for surveying and reporting. The universal electronic system for patient records will work as a nationwide system that will house the complete medical records and histories of all American citizens. This will allow for immediate access of critically important information when it is needed. With one of the largest causes of medication errors being the delay in transfer of patient records and information, a universal system would fill the gap and allow the records to be accessed immediately. Annie Carey states, insufficient information flow happens when necessary information does not follow the patient when they are transferred to another facility. This information can be crucial to the survival of the patient, and in case of an emergency, it can prevent medical errors. The standardized system for surveying and reporting will be a nationwide generic form for reviews of medical facilities that will be completed by medical professionals reporting on their coworkers' abilities. With the implementation of this system, it would help aid in public safety and in the internal affairs of medical facility itself. During a podcast interview with Dr. John James on public safety, Dr. Sweeney states, doctors do know who we go to and who we wouldn't, who is safe and who is dangerous. This information should be public knowledge, and patients have the right to know if their professional can truly be trusted. After this time is allowed for corrections and adjustments to be made, the report should be released to the public. With this knowledge made available to the public, it will assist patients in finding the best recommended physicians. Patients will have the comfort and confidence that their physicians can be trusted and provide the highest level of care. The goal of these small solutions is to incorporate them nationwide and lower America's medical error death statistic. These are very possible to implement, and both will improve the statistics, efficiency, and accuracy of healthcare system. With the sets put together, they will not completely diminish the problem, but they will minimize the occurrence of errors and open new windows of opportunity to correct the system. To begin the process of implementing a universal electronic system for patient records, it would require 4 large steps: the building of the system, transferring of the records, organization of the information, and the securing of the information. The building of the system would take more time, money, and digital media specialists to work in system design. It would most likely take more time than any other step, being they are needed to design a large, secure system that can be trusted with confidential information. The next step would be working within each state to transfer all records from each person into the new system. It'd be set up within the program to have categories for each state, and the person's record would be within the state that they reside. It would then be organized by pediatric and adult files for each state. Within the file, the full names would appear in alphabetical order, and the last 4 digits of their social would appear to distinguish patients with the last name. The system would then have several security locks and system barriers to protect personal information. The system would have patient access portals so they could access their medical records if needed to or desired to. This system would make it easier to access patients' information in case of an emergency and allow the person the convenience of sharing records between multiple specialists and other physicians. This system would also prevent records from being lost and keep everything localized in the program to allow fluency and the best monitoring of the patient's health. A standardized system for surveying and reporting. When implementing the survey and reporting system, it has a lot easier of a process. As Dr. John James suggested, the survey should be a standardized survey nationwide to allow consistency. Dr. John James stated, "If you were to implement this in hospitals where physicians are evaluated by their colleagues, that would be a guide to some of the things that they need to fix." This survey would be a mandatory biannual event where the generic survey would go out and the professionals writing the reviews would remain anonymous. To further improve Dr. James' solution, the results would be distributed following the review by the facilities management, allowing the professionals to see the areas they need to improve upon. If it is a major problem that can be life-threatening to the professional's patients, then they would be monitored closely. When the results are released to the public, it would also show an update on the professional and list what steps were taken for the betterment of their tactics and care. This will give the public the knowledge of who to trust, and it will hold the healthcare providers accountable for their actions. Funding and timing. Both solutions can be done and fully implemented within 5 years. It would take time to work out any problems with the systems and get them both fully running, but it is fully possible. The universal record system will take money to put together. There will have to be someone to hire the right people. For the system to be set up, it would be easiest to use the federal government to help secure and nationwide. It would be funded through various outlets like percents of taxes. Both state and federal could help fund it, but also including insurance money if the government works with different large companies. The surveying system can be released through the American Hospital Association to require hospitals to use it as a generic survey to help their staff improve error statistics. A safer healthcare system starts with you. There are thousands of U.S. citizens falling victim to medical errors across the nation. It has been widely dismantled and has caused caught the attention of the American public as well as the federal government. These adverse events happen every day and pose a true threat to America's healthcare system. The United States cannot completely remove this problem, but it can be improved. This affects everyone, and change is needed. Thank you so much.